I invite you all to come visit my office because I'm extremely proud of it. But when you walk through the door, above the window for our reception, printed as bold as I could get it and still fit within the wall space, is our mission statement. And unfortunately, I've made my employees memorize it. Every team meeting that we have every month, I'll say, okay, who can recite the mission statement? And the reason I bring that up is because that is the why of what I do for a living. My mission statement says that it is our mission to break down the barriers that currently exist in the patient-physician relationship, to restore mutual trust, and to provide excellent, personalized health care. So that's the why, guys. So I'm going to tell you how I did it. Now, at the time that I decided that there were too many barriers that were coming between me and my patients, I was employed by a hospital-owned clinic in a place in the Ozarks that has two major hospitals systems that fight each other all the time. And there is one major one that claims to be merciful. Thank you, there's one person who knows what I'm talking about. That is a behemoth. And that's who I worked for. And so the transition for me sounded much like the WKRP transition from easy listening to rock music. Okay, there's a couple of people that know what that means. Very abrupt, okay? But I started planning this about a year and a half to 2 years before I actually took that plunge. And it's a good thing because in medical school and residency, they did not teach me anything about business. And I think one of the main things that we forget, oh, we're going to have this wonderful practice, is that it's a business. And that's going to make the difference between whether you're successful or whether you fail. And for me, failure was just not an option. So I wanted to have a good business base to plunge into this dream that I had. And at the time, they must have existed, but I was not aware of any other primary care offices who were doing cash-based like this, priced for the middle class. I mean, I'd heard of concierge medicine, but I said, why can't we bring that concept down so that just about anybody can afford this? Why should only the wealthy have a private physician? So that's the basis that I started with. And the very first thing I did was I asked a business attorney to take a look at my contract with the hospital because location was going to be key. And unfortunately, I had a covenant clause, a non-compete clause in my contract, 25 miles, 2 years from not only the office I was at, but also at their headquarters in Springfield, Missouri, which wiped out the I-44 corridor for me, which is why I drive an hour to work every day. Because it's very difficult to move an 80-acre goat farm to the lake. I looked into that too. So he took a look at that and he said, you know, I think that a jury would uphold this. I think you're going to have to abide by it. So that's why I was looking, okay, where do I go? I'm here in the middle of the Ozarks, and you guys, Winter's Bone is not a novel, okay? This is real stuff. I swear I have Uncle Teardrop as my patient. So the Lake of the Ozarks was ideal because they have a lot of small businesses. It is a party lake. Come visit. And they have a lot of small business owners who don't insure themselves. They certainly don't insure their employees. And you may have some employees who work part of the year for this place and then have a different job the other part of the year. So they don't have insurance at all. And my type of practice is ideal for people who don't have insurance. It's ideal for those who have a high deductible health plan. It's ideal for those who have a Christian health share program. But I also have patients who are Medicare patients. I have patients who are VA patients. They can get a ride up to the VA in Columbia, and it's free. But they choose to pay out of pocket because they want to have a personal physician, one who is going to be taking care of them exclusively. So don't be afraid that, okay, you're going to have to pay for it out of pocket if you're a Medicare patient. One of my newest patients is 86 years old and is one of my biggest cheerleaders because nobody was paying attention to him because he's 86 years old. Nobody would take the time to try to figure out if this was normal aging or if he'd had a lacunar stroke or... So, anyway, so the first thing I did was have the business attorney look at the contract. I figured out where I was going. The challenge then was how to build a business plan. Guys, this is extremely important because without a good business plan, you're not going to be able to get that financial backing that you need. I'm not independently wealthy. I mentioned the goat farm, right? That's what my husband does for a living. You don't see many rich goat ranchers. So the first thing I did, which was pretty smart, and I think SCORE is nationwide, SCORE. This is a group of retired business people who volunteer their time, and they will kind of help you if you've got a business idea and you want to run it past them. And when I ran it past this guy, he was like, wow, this sounds like a great idea. I've never heard of it. I think it'll be great. I don't know. Let me look and see if there's other people who do this. And I never heard back from him. But he did give me some important information about how to build a business plan, and one that is rock solid. So then the next thing I needed was a banker. And you would think that my personal banker would say, hey, yes, I believe in you. I know you're a great doctor. I think this is going to... No. He says, I don't think so. I think it's really risky. Of course, the fact that he was the son of one of my partners at the hospital clinic may have had something to do with it. So I just found another banker who was totally sold on it and saw this rock-solid business plan that I had and gave to him and said, we can do this. And yes, I did get an SBA loan. I think it's ironical to use the government against the government. So here I had my location. I had a rock-solid business plan. The other thing I didn't learn in medical school or in residency is how to market. I couldn't sell. I'm not a salesperson. I couldn't sell a need, much less a want. So how do you sell an idea? Particularly one that's extremely foreign to people. What do you mean you don't bill my insurance? What do you mean I can have a physician who doesn't bill insurance? So what I did, now I have a friend who is a sales rep, and he said one day, you ought to have a sales rep. Somebody who sells you. And as far as I know, I'm the only direct primary care clinic doctor who has a sales representative. My sales representative represents me in the community, in the business networking, and sells one-on-one. What I did was I took part of what would have been my salary and I give it to her. She has a salary, she gets a commission on new memberships, and she has an expense report and mileage that she gets. And that leaves me to do what I did learn in medical school and residency training. It frees me up from having to be the smiling face. And there are times that she's like, okay, I really need you to come speak to this group. Great, I can do that. But she can go to all of the BNI meetings, and she can be involved in that, and she's the person who is my wall for those chronic pain patients that are looking for somebody. They can only go through Ann. And Ann said, oh, Dr. Powell does not do chronic pain. I'm so sorry. She's a primary care physician. Or as I like to tell patients, I'm not in this for the one-night stand. I want a marriage. expect that from a woman, right? But that's the whole idea. She sells memberships, is what she does. So these memberships are kind of well, I don't know how, well, that's what she does. I have a staff that's made up of 4 people. Me, my nurse, who I stole from the hospital system, a member service representative. Now, my member service representative is a receptionist. She answers the phone. She's that happy face that people see when they come in. She does the billing. But she's also a medical assistant. So when my nurse might be in the other room doing a phlebotomy on a hemochromatosis patient, if I have another patient come in, she can room the patient for me. When my nurse is on maternity leave, which I hope she has done for the last time, she nurses for me. And then I have Anne, my sales marketer, my sales representative, wow, she's amazing. Use of technology. We try to use technology as much as possible because we are available 24/7, 365 days a week. My cell phone is over on the table there, so mine is 20 minutes. But if I get a text here while I am speaking to you, and it's one of my members who says, I have a UTI, I need some antibiotic and pyridium, and I tell you they know when they have a UTI. As soon as I get done here, I can get on my phone and I can go directly to her chart and I can fax the prescription, even though I'm in Orlando, Florida, and her pharmacy is in Osage Beach, Missouri. We use Skype, FaceTime, email. I'll have patients text me some bizarre pictures of things and say, do we need to come in and have this stitched up? Or, look at this rash, is this weird or what? So we try to use technology as much as possible in our practice. On Wednesday, I had a 9 o'clock appointment that it was a Skype visit. And what's cool about this is the patient has Cushing's disease and she's kind of hard to understand, and so this whole talking on the phone thing doesn't work well because I can only understand 1 of 10 words that she says, but she can type. And so she's typing away on Skype, and then when I get done, I can highlight that, I can copy it, and I can paste it right into her chart. Then, let's see, Wednesday afternoon at 2:30, I had a phone call visit, and it was on my schedule. And the patient, because she just had some questions. And she wanted to ask some questions, but she, didn't want to have to go through the nurse. And so you use technology to your benefit and to your patient's benefit. Let's see, what else did I want to tell you? I surrounded myself with some very helpful people. I have people tell me, man, you're really brave to do this. And I said, well, I don't know, brave, silly, who knows, crazy. But I surrounded myself with some very important people. First of all, I have a great business attorney who I talked about how I envisioned this. I told him about my business plan, and he says, okay, here's how I think you should have your business constructed, and we are an LLC and S Corp. I pay myself as an employee. Then I have a marketing firm that I used for my website, because I know that you can do this yourself. I also was not trained how to do this. I want my website to look fantastic, and I challenge you to find a better looking one. Go ahead, you've got my website there. Go ahead. I'll wait. No, I won't. And they also do things like brochures, and because we have a consulting business on the side, and may go to have a booth at a conference. They do the backdrops and everything that we need for that. I have a business insurance agent who said, okay, you need this kind of insurance and this kind of insurance and this kind of insurance to make sure even though we lease a spot. I have a financial advisor that also happened to be the same financial advisor that I had when I worked for the hospital, but because he works for MetLife. Anyway, he has been one of my biggest cheerleaders and said, Jen, this is what I think you need to do in order to prepare for this. And And then, of course, we have other insurance. I want to encourage you, if you want to do this type of practice, shop around for your medical malpractice insurance, because we have a group in Missouri that is actually giving direct primary care physicians a discount on the malpractice, because they understand that we're going to have less risk because we have a smaller patient pool and we're available 24/7. Let's see. The other thing that I do, I have a bookkeeper because I'm also not an accountant, okay? And I look horrible in orange. And then we also employ a PEO. Have you ever heard of this? It's a professional employer organization. For 2% of our payroll, they do all the payroll stuff. They do all the employee stuff. It is fantastic. It's great for small businesses. And they'll let me do as much as I want to do, but they offer, they even do training on how to use the fire extinguishers and things like that, so that we can laugh and make fun of them while they're giving the presentations. But this is a great thing for any small business owner to do. I want to give you just a few pitfalls to avoid when you're going to open your own practice. First of all, avoid big money marketing, television, billboards, magazines. The only magazine that we found is helpful is there is a magazine called Relocating at the Lake. There's a lot of people who are retiring to the Lake of the Ozarks. I am not really sure why, but they are. And so that has been one of our cheaper types of ads that we use. But I, too, use a local radio station. And it was quick. The DJs, who are also the owners, became patients right away. And they're some of our biggest supporters. Avoid yellow pages. Who uses yellow pages anymore? Do you do that? No. And avoid landlines. You don't need a landline. You're going to have to pay for a cell phone anyway. We have a cell phone. And our patients understand that we use a cell phone. So they know that our member service representative can only talk to one person at a time, can only text one person at a time. What is more frustrating than having multiple lines, but they're busy? So to me, that's a landline is a big waste of money. You don't need it for fax machine. There's internet faxing. EMR, the only, I agree, use an EMR if it's going to be only for your type of practice, your cash pay practice. That is more for the patient's privacy than anything else, okay? Because if you don't have any insurance companies that have access, it's going to make it much more private and protected for your patients. The reason I like it is because of the portability. I would love to use paper, but you can't really be portable with paper. As I said, if I have a patient who texts me, I don't have to say, tell me what your allergies are again. Okay, now what meds are you on? Okay, what's your date of birth? All the stuff I have to do. Oh, and then give me the phone number for the pharmacy that you want me to send this to. I can go right into the chart, and I can just send the prescription from there. Another big, huge waste of money is maintenance of certification. Don't waste your time. Guys, if you're a specialist, and I know that you've gone to residency and you've passed your very first board, to me, that's all I need to know. Because the last time I checked, anatomy, physiology, and biochemistry doesn't change every 7 to 10 years. So I know you've got a good knowledge base. So, hybrid practice, isn't that kind of like being a little pregnant? I don't understand how you would. The reason you're doing this kind of practice is for the patients, to give good patient care. If you are doing a hybrid practice where, okay, on some patients I'm going to be cash paying, on some I'm going to take their insurance, that is cherry picking. You're going to have people claim that you are cherry picking when you are a cash-based practice. By golly, your retort is going to be, oh, so you bill every single insurance company there is, correct? Because if they don't, then they're cherry picking. The other nice thing about not billing insurance is, of course, you don't have ICD-10, you don't have meaningless use, you don't have to worry about any of those other problems, and the other pitfall to avoid is DOT or other federal programs. Don't waste your time. Don't play with the enemy. Thank you.